this hour on the issue of mental health. Today, you'll hear from brave people who have agreed to share their stories as well as professionals.
Now, in these stories, you may find the words that you need to hear today. Let's begin with something affecting the mental health of so many of us right now. It's the debates and the division they've emerged during this pandemic. The arguing, you've seen it on social media, about how we're handling the virus and the shutdown. Well, Scott Wickersham asked how we can avoid coming out of all this more fractured and anxious than before.
The COVID-19 shutdown started with encouragement, togetherness, and resolution, but it's ending with anger and accusations and finger pointing and people taking sides to wear a mask or not.
People just battling it out. Just a lot of anxiety. Folks are worried.
Open up or stay closed.
Us against them, and I think it's a little bit more of a political battle than anything.
It's most evident on social media, people hurling words back and forth like insane, stupid, inconsiderate. You see phrases like government taking away our rights, if you're scared, stay home, that people who don't wear a mask or want to reopen are self-centered and don't care about the health and even lives of others.
COVID-19 has affected everybody a little bit differently. And I think that's where we see the divide.
Dr. James Rochelle says a lot of people engaging in the fight need to consider that. One person may have lost their job because of the virus. Another may have lost their mother. Maybe before people actually speak or engage online, they should maybe take a step back and think about other people's experiences beside your own.
Correct. A lot of times when you're online, there's that anonymity to it. So you kind of can feel like you can put anything out there and not worry about repercussions.
But there can be friendships lost, coworkers and family members alienated. Dr. Rochelle says those losing their temper, feeling their anxiety or anger grow, maybe should take a step back toward time with family, perhaps a hobby, and less time prowling social media, taking part in flame wars, or reading news that turns this all into a political debate. Lloyd Bennett sums it up quite nicely.
You know, this is crazy, man. I think we all need this. This is the time we all need to pull together. You know what I'm saying? Everybody. It doesn't matter what color you are, race you are. Everybody needs to pull together right now, you know.
And as for that mask debate, Dr. Rochelle says to remember there are legitimate reasons that some people don't wear them, other than just not wanting to wear them. Some people have anxiety issues covering their faces. Some just can't breathe well with their face covered.
And you hear so much about the new normal. That phrase alone can trigger anxiety in some people. What is the new normal and how do you adjust? Well, joining us now is Kate Penny, a licensed clinical mental health counselor from Atrium Health. Kate, thank you for being here.
Thank you. Thank you for having me, Brittany.
Absolutely. We want to start with that divide that Scott just talked about in his report, the back and forth. Is that part of our new normal?
Oh, Brittany, I don't think it has to be. I mean, in the beginning, when all this started, we all came together as communities, families, just supporting each other. And I feel like we can get back to that. We need to show empathy and understand why people may feel strongly about not wearing masks or wearing masks. And I think if we can show that and offer that understanding and respect for our community members, for our neighbors and friends, then we can get back to where we were when this all first started.
That certainly sounds like it would be nice. You know, this is already such a tough time for people. You've got people divided over political issues, racial issues being added to that. And then the pandemic, which is nothing like we've seen before. You know, it's enough to send some people who may have already been struggling to a really difficult place mentally. Who would you describe as being most at risk?
Sure. People who already have been dealing with anxiety, of course, are more at risk. Also, people who live alone, maybe don't have that support system in place. People who have elderly parents that they're concerned about, and maybe now, because of the pandemic, they can't see them as often. Those would all be people who are at a little bit higher risk during this time.
Scott mentioned, you know, if you yourself, find yourself getting too caught up in this, maybe avoid social media. But what if it's someone you care about, who may be taking these current debate issues just a little bit too far? What would you recommend?
Sure. I think reaching out to them, we are physically distancing. We don't have to social distance. We can reach out via FaceTime, different apps to connect us to family, obviously phone calls. If you do have someone who is really struggling, we here at Atrium Health, we have our 24-hour behavioral health call center. There are licensed counselors and nurses available to talk to about you or a loved one 24 hours a day, 7 days a week.
All right. Kate Penny, thank you. We're going to hear from you a little bit later in our program again. Thanks.
Information was just released this week, and it shows more than a third of Americans have shown signs of clinical anxiety, depression, or even both since this pandemic began. So what are those symptoms? Let's go over these right now. For anxiety, it's as if your body goes through high alert, which can lead to nervousness, restlessness, feelings of panic or dread, increased heart rate, and difficulty focusing too. The warning signs for depression, they're different, but they can vary. They can include feelings of guilt, worthlessness, helplessness, irritability, persistent sadness or feelings of emptiness, and a general loss of interest in life. Now, if you're feeling any of this, Atrium Health has a helpline. It's staffed by mental health professionals and registered nurses. Anyone can call, and they'll connect you to mental health resources. Here's the number right here, 704-444-2400. Now, it's important to note, it's available 24 hours a day, 7 days a week.
And among those at risk for depression and anxiety are our frontline healthcare workers. Many hospitals are bracing for a mental health crisis among doctors and nurses. Our Damani Lewis explains the people caring for everyone else need to take time to care for themselves as well.
We've all seen them. The emotional, well-deserved salutes to our frontline healthcare workers. They're a reminder that what these workers do every day is truly heroic.
You are faced with talking to patients that are going through anxiety, depression, talking about wanting to end their lives.
Anastasia Carrillo works as a psychiatric nurse for Atrium Health. She helps those who are at their most vulnerable and oftentimes alone. But like all frontline workers, this pandemic has tested her mentally. She has to remember to take care of herself so she can take care of others.
I really focused on self-care. I focused on staying grounded, having my family and friends close, creating those strong bonds with my teammates that I work with, so that we can, feed off of each other.
While some have strong support systems, doctors say others are struggling.
We have seen them start to turn to the resources that we have.
Dr. Wayne Sparks is with Atrium Behavioral Health. He says for the past several weeks, they've seen an increase in employees seeking counseling through an employee assistance program.
Being able to offer virtual visits for people that are concerned about coming in, but they want to get some help. And we've seen about a 35% increase in those numbers just over the last few weeks. So we know that there's a lot of people reaching out for some extra help.
Dr. Sparks says those numbers are expected to continue as frontline workers push through the pandemic. Anastasia says the mental effects of the pandemic will far exceed COVID-19's physical toll.
The loss of family members, that's a grief that can go on for a very long time. The grief of losing your job or not knowing how you're going to take care of yourself or your children. That anxiety and depression is going to prolong. It's going to go past once we overcome this pandemic.
And Channel 9 has a list of mental health resources for all 22 counties in our viewing area. You can find it on our WSOC News app and on our website. Just look under Community.
All right, imagine being quarantined in an abusive home.
24 hours a day of that person being able to take out their abuse on you and your children possibly.
Still ahead, when home is not a safe place and how to get help.
But next, the stresses of job loss and financial insecurities. We have an expert here to help you through it as we continue with Eyewitness News Mental Health Check.